Hello, welcome to our presentation on the summer research experience for undergraduates that the three of us participated in this summer, as well as some of the results of our project. So a little bit of background here. The project is sponsored by a National Science Foundation grant. And the purpose of the grant is to increase underrepresented minority participation in STEM fields, as well as to attract students from Iowa, Illinois, and Nebraska into STEM. This is an alliance among 16 two-year and four-year colleges and universities, and so it's a big grant with a lot of working parts. This summer, as you know, it was physically impossible to bring students to any kind of research experience at the university system. In the past, Iowa State had brought students from community colleges to do some undergraduate research, and that wasn't going to happen. So instead, they decided to open up the summer REU to a virtual research experience. And because it didn't matter that the students weren't going to be at Ames, Iowa, they were able to do this for a much bigger program. So in the spring, the university sent out a request for faculty who were willing and interested to run part of an undergraduate research program, and I volunteered. And so the program is essentially 2 months long. The students are meeting on Mondays and Thursdays, as well as being expected to spend approximately 20 hours total each week on the project. This is a compensated research experience. So what happened? Well, I'm in Iowa, and about the beginning of March, I realized that although the state was publishing data on COVID-19 numbers, the data was not being archived anywhere. You could get information on what had happened today, but if you wanted to compare that to what had happened yesterday, that was not capable. There was no capacity for that. So I started a spreadsheet and started just every morning recording the numbers. So I have data on the COVID-19 outbreak for the state of Iowa that goes back to early March. When the research experience started, I shared the data with the students and I said, here's what I want you to do. I've been doing the analysis in R because that is going to be the most common statistical package of the future, unless you're using Python. And so you should learn some R. And R is particularly useful for gathering data, cleaning data, and analyzing data. And it really is a statistical package, although it can do a lot of other things at this point. And so I had some goals for them. I said, look, I want you to learn how to use R. If possible, I would love if you could learn some data scraping, which is where you go to a website, you sort of automate the saving of the information, because right now I'm still needing to go and record data every day. In the end, that didn't happen, but instead the students were able to find pre-processed data from some very reliable sources, and we've been using that. So then we wanted the students to develop some algorithms to possibly predict what would happen with COVID-19 outbreak, and then finally to develop something that would share their work with the general public. And so um, that was the project. A little different than a lot of other kind of research projects, but pretty standard for a data science project.
Hello everybody, my name is Ahmed Hassan. I'm a senior at Iowa State University and I'm studying data science. I'm going to talk about the next 3 slides for this project. So to start off, here are some questions at hand. So to start off, what is the data set? The data set was collected by the following sources. So we have New York Times COVID-19 data repository. We have COVID tracking project of the Atlantic. We have, most importantly, over here, we have the Johns Hopkins University Center for Systems and Engineering. And what questions or answers did we expect to find or achieve during this project? So can we create a visual to help people make personal decisions about the next 2 weeks in regards to COVID-19 within their particular area or any region within the United States? And these visuals would have to be easy to use, up to date, and visually pleasing. So we're trying to entice the need of use factor. We want people to open their phone and actually feel the responsibility to know what's going on within their particular location. Alright, and now I'm going to talk about data discovery, capturing, and cleaning. I'm going to start off by talking about the CDC, and this is the Centers for Disease Control and Prevention. So this is deemed to be the most reliable and main source of information when it comes to COVID-19 currently. And if I was to go to the website right now and search for certain data visualization tools or some dashboards, from a functionality standpoint, there's limited functionality to interaction with the actual dashboard. And from a user experience standpoint, it fails the 3-click or tap rule. So this is quoted as the unofficial rule in a website that suggests that users should be able to find any information within the website with no more than 3 mouse clicks. From a perception standpoint, there's media-built social stigma onto the CDC itself. So if I was to Google CDC, there's within the top news, as you can see here on the slide, there's a bunch of negative stigmas that's already been portrayed towards the CDC itself that might stir people away from trying to access this type of information. So a solution to all this would be for us to create an own app that, one, would acquire the same source of data as the CDC, which is the most reliable. We're going to use R or RStudio to program, clean, and display the data. We're going to automate the data acquisition. We're going to create a user-friendly experience and hopefully develop an app. So for this slide, we're going to be talking about data acquisition and automation. So if we're going to be making graphs or dashboards or any form of data visualization within R itself, we're going to need a source of data. And one thing that's good within R is if the particular file, that's an Excel file or a .csv file, is saved within the same folder as all my R files, I can make an object out of that file itself within R, and I could further manipulate it and make graphs out of it. But in this particular case, we wanted to automate the data. So we needed a source of data that was up to date with the latest COVID-19 cases numbers. So for this example right here, as you can see up here, this is an example of the COVID tracking project at the Atlantic. So if I go to the website and I was to click this link right here, it would download this .csv file that I need. But if I wanted to make an object out of it within R, I would copy the link address of it, and I would use the download.file function, and I would paste the link address that I copied, and it would automatically make a object out of that CSV file that I need. So for our particular project, we use 4 different sources of data as listed below. And what we did was we took chunks out of each one of these data sets to make one main master data set to where we could manipulate and select columns that we needed to make the graphs and dashboards that we needed. And one thing that didn't work during this process was in the beginning steps, I tried to get data directly from the CDC website. But the issue with the data that I got from there was there were multiple data sets within one Excel sheet that would have been nearly impossible to edit within R itself.
Throughout the research process, we faced many challenges. However, we found a lot of solutions within the packages we used. Specifically, the leaflet package and the Tigris package were extremely beneficial in helping build our visualization of the data. We also used cleaning packages such as Dipler, Tidyverse, and StringR to help modify the data so that we could use it more effectively. On the Shiny app, there will be a page dedicated to the packages we used. One process that I would say was extremely important was how we broke down the data. We got data from varying number of sources, and they had different numbers of variables as well. We had to slice and filter out some of the data to help fit our needs. The data that we pulled from all sets were the positive cases and the deaths. These were important statistics for us in developing our Shiny app. Finally, we also spent time modifying data frames and combining them with geospatial data frames as well as population data from the census database. The geospatial data came from the Tigris package and helped us map out our data in our Shiny app. The population data came from the census website and helped create our per capita rankings and map. This process took the majority of our time, but exploring the data gave us a lot of new information so that we could create an effective Shiny app. There were lots of bumps in the road, but it all came together in the creation of our Shiny app. Now I would like to touch a little more on our actual project and show you our dashboard. Welcome to our COVID-19 project and the dashboard view which we have created. Here you can see a specific state and the cases per capita as well as the total positive cases for the state as well. Here is a chart of the rolling 7-day average of new positive cases in the state. And then in addition to that, there's also data presented of the raw values of new positives as well. Here is a live dashboard of some of the common statistics that will be seen on other sites as well of COVID-19. And based off the inputted date, they change accordingly. And then the user can select their own state as well. So for me, let's say I select Iowa on the 4th of July. The statistics will come up for Iowa. And as you can see, the map adjusts accordingly. And then here's the 7-day average for Iowa since the beginning of the pandemic. And despite there being an NA value in the hospitalized section, all the other data is filled in. This just means that Iowa had not reported hospitalized data for the specific data frame we used. Next is our rankings page. Here is a map of the United States as a whole. As you can see, very common hotspots are darker and less common hotspots are lighter. And you can also input positive cases per capita and the map will adjust accordingly. And then finally over here, we have total positives, positives per capita, total deaths, as well as deaths per capita. And these are rankings of greatest to least of all 50 states and how they rank against each other. Finally, we have a couple pages dedicated to understanding more. Here is a list of all the packages we used to create our dashboard. And then also here's a page dedicated to how we use the data and more information about the data if interested. As you can see, there's information about the license information, and then access to the raw data as well. Overall, this project did take a lot of time and dedication, but I believe that the user interface was something that we were all very proud of in the end, and we were able to create something that will be beneficial for users in the future as they make personal decisions.
Project, and as we know in academia, things can go on for years. So some ideas of extending the work, which I suggested to the students, was that we could get data for the entire United States and give total positive data or how many positive per capita in each state. The students actually did that. So you should have already seen that, as well as perhaps something like a 7-day growth rate to see which of the states are increasing in COVID-19 patients recently. Also, some kind of ranking of states by positives in growth rate, and we've done that. Finally, something like figuring out an algorithm that might predict the percent chance of catching COVID-19 in a particular location, and also the transmission coefficient, which is R sub t. And the website R sub t Live actually gives us this information, but it graphs it by smallest value to largest value rather than graphing it by location. And we thought that it would be interesting and perhaps useful to be able to see what that would look like on the graph of the United States, so you could see where as a location-based thing were things getting worse or getting better. Here is today's transmission coefficient data, and the red states are those where the transmission coefficient is above 1, the disease is spreading rapidly, and the green states are where the transmission coefficient is below 1, and so we do not have rapid spread there.
This summer, I had the opportunity to participate in the Inspire LSAMP REU program. We spent a lot of time learning about the research process. This was very beneficial for me because I knew I wanted to be exposed to research before my college career was over. The concepts we touched on were experimental methods, statistical analysis, and data analysis, as well as research manuscript structures. We also spent time participating in virtual community building activities. These were structured as more informal meetings rather than the classes we attended for the research course. We were able to network with other students from participating universities, and I found this very beneficial because it was a virtual experience and having a little bit of a personal touch was very important. We also were handed weekly articles about diversity in higher ed, and then we held discussions in small groups to discuss the articles. This was very important to me as well because it gave me a new perspective on diversity in higher ed, which is something that is important to me. Overall, I believe this experience taught me a lot and built my problem-solving skills and my team working skills in working with Ahmed and Dr. Bergen. I also had the opportunity to be exposed to research and network with other students and build a project around a central question. I'm really excited to see where this project goes in the future and how I will be able to use my new skills in my career.
Takeaways that I have during my summer research experience here at LSAMP Inspire. I feel like it was an overall great experience. I was able to learn R and R Studio. I was able to learn data acquisition and automation technique that I feel like is universal, and I can take this skill within any project that I'm going to have in the future. I learned how to publish a dashboard that's from R onto a online website. I fully enjoyed the online research experience, and I'm starting to think about masters for data science. And I was able to create a new workstation in my room for maximum productivity during the summer.
Students that the topic of COVID-19 might affect the students personally. It's entirely possible that one of them would have a friend or family member who came down with this very serious illness, and that would affect their work on the research experience. In this particular case, it didn't happen, but I think that anyone who is working with current data needs to be aware that that is a concern. On the other hand, as those of you who've been working with Sensor for a while know, data which is relevant to the students' personal lives is always going to be helpful in make them really kind of work harder and learn a little bit more. Second was one of my students only had a year of calculus and a programming class, and that was more than sufficient to work on this project. This is a research experience that could be done by a student after their first year in college, which is always something which I'm looking for. And finally, I was concerned that not having the students in person in the same space might be distracting, but I found the students were more than capable of working independently and contacting each other for help and support, even though those peers were not in the same room or even in the same state, and then contacting me if they decided they needed more help than that. So I think that this kind of project could work in the future, and I hope that we continue to do it. Thank you very much.